Okay, welcome everybody. Let's get started. A little bit of context for today's announcement. Many of you recall Congress passed the Affordable Care Act. I was a member of Congress and supported that. One of the things it did is it gave states the ability to set up health exchanges. You might recall that Colorado, through a bipartisan deal, did set up an exchange, did the Medicaid expansion. So Colorado's always been on the forefront of innovation, and I would point out it's because Colorado has our own exchange that we're able to produce these savings, that we were able to do a reinsurance program. Some states rely on the federal exchange, and they don't have that same flexibility to really go after costs that we have in Colorado. In our state, we have about 6 or 7% or so that are still uninsured. That's significantly down from the pre-Affordable Care Act days. And as premiums, when premiums go up, the number of uninsured also goes up. And it's simply because families have to make sacrifices and can't always afford health care. So the last legislative session, we made progress in many different areas on saving people money in health care. The announcement today is about the impact from the reinsurance bill. We have our legislative champions, Senator Rankin, Representative McCluskey. I also want to acknowledge Representative Rich and Senator Donovan for their work. But before we get to that, I want to talk about some of the other systemic changes that will result in saving people money on health care. We passed a hospital transparency bill, a lot stronger than the federal efforts, which we applaud on hospital pricing transparency, but in Colorado it goes further. We protect consumers from out-of-network billing. We are looking at piloting a prescription drug importation program from Canada, saving people money, not just on prescription drugs, I would add, but if that gets approved and goes live, that also means saving people money on premiums, because even if you don't have a prescription drug yourself, you basically have costs shifted to you for the high costs of prescription drugs from others. We passed bipartisan legislation for a public insurance option. And we also looked at a number of different areas where we can reduce costs. Now, for today's announcement, we passed, as you know, one of our priorities, along with Senator Rankin, Representative McCluskey, Senator Donovan, and Representative Rich, a reinsurance program. What reinsurance does, very simply, is it takes some of the highest cost cases, cases that are hundreds of thousands of dollars in reimbursements, and prevents those cases from driving up rates for everybody else. We looked at a number of different models in this area. We looked at cost controls. We looked at hospital fees. Ultimately, there was a legislative hybrid, an agreement, a bipartisan agreement born out of our discussions with CMS in Washington that would allow this to move forward in Colorado as it has in several other states. We knew when we were getting into this that states that had implemented reinsurance saw decreases in everywhere from 9 to 20% in insurance in the individual market. And in a moment, we'll reveal the impact in Colorado. I want to highlight again, this is for the individual market. That's about 8 or 9% of Coloradans. It's also the most price-sensitive part of the market because unlike people who might have an employer share, who pays part of the insurance, individual market, you're paying all of it out of pocket. So these are literally the folks that either will go without insurance if they can't afford it, or will have insurance if they can. So by bringing down rates, we will make a dent in the number of uninsured. And today we're really seeing that the hard work we did this legislative session will come to fruition. And we're proud to announce that for the first time in Colorado's Connect for Health Insurance Exchange history, we're anticipating that ratepayers will save money, rates will go down by an average of 18.2% due to the reinsurance effort. So this is for the calendar year. Next year, rates will go down 18.2%. These are the savings for families in different parts of our state. You'll notice that there's higher savings in western Colorado. That's because they've been getting ripped off even worse than Front Range residents. So the savings are more in the areas that were higher cost. But this is for a typical family of 4. So you can see that in the Denver metro area, a family of 4 in Colorado Springs or Denver saves about $3,000, $3,300 a year. Think of what a family can do with that. It could go towards a down payment on a home. It could go to college savings or retirement savings, to building a porch. $600 per year. I mean, that's just transformational in terms of saving families money, and then also families that, of course, couldn't afford insurance for a family of four without these lower rates, and now will be able to have the benefit of insurance for themselves and their families. So these are estimates. The final rates, of course, will be out in September or October. They're telling me to get back to the microphone. The final rates will be out in September or October, but these are estimates that are based on the preliminary data that was provided to the Division of Insurance. In a moment, I will turn it over to our Director of the Division of Insurance. I would point out that there's a few risk factors. One is instability around lawsuits. As you know, the lawsuit that could potentially strike down parts of the Affordable Care Act would obviously cause great uncertainty in the market if that were to succeed. And of course, we also rely on the federal waiver, which all 9 members of our congressional delegation, Republican and Democrat, have endorsed that request. And of course, we work closely with CMS during the crafting of this program, and we're optimistic that that will be granted as well. If you look at the handout that you got, the highest rate increases were in 2017 and 2018. That was a time of heightened uncertainty around what lawsuits and what might happen legislatively to even repeal the Affordable Care Act. So there was a great uncertainty premium that was built into those prices. Now the risk premium has decreased. And the reinsurance program is going live this year, meaning that in Grand Junction, there'll be a 27.7% decrease in rates. In Pueblo, a 26.7% decrease. In the Eastern Plains and San Luis Valley, a 24.9% decrease. And in the Western Slope and mountain communities, the largest decrease, 29.1%. So, you know, once it was clear that the law was here to stay, the certainty increased and allowed for better pricing on the exchange. We're still waiting final approval from the federal government to establish this reinsurance program. As I said, we're also mindful of lawsuits that could threaten this progress. And we know that the individual market, while it's only 7 to 8% of healthcare consumers, is the most price-sensitive market and the one that has the greatest correlation to reducing the number of uninsured and saving families money. And while more people are covered, when more people are covered, we also save money for the system because providers don't have to shift the cost of the uncompensated care in the form of higher premiums. Meaning, when we decrease our number of uninsured Coloradans by reducing rates in the individual market, it also creates a downward pressure on the employer market, the small group market, all of the other markets that exist, because less cost shifting has to occur if we can significantly reduce the number of uninsured Coloradans from 6 to 7% to a lower number, which I'm confident will happen, particularly in western Colorado with these numbers. I want to thank everybody here, including Tamara Drangsvit from the Peak Health Alliance, other advocates who are working on reducing the cost of health care. Again, this bill wouldn't have happened without Representative McCluskey and Senator Rankin, important partners on a bill that was challenging because of the various iterations that we had to change based on input from Washington. When you rely on a waiver for a bill to go through, you have to be willing to adapt, sometimes more than you might like, but our legislators and their colleagues were willing to do that. I also want to thank Representative Titone, who has joined us as well. And I'd like to introduce Commissioner Mike Conway, who's been working day and night to make sure that we are delivering these cost savings to consumers. Very exciting next year. Not only the first time in the history of the exchange that rates have gone down, but a very significant decrease, 18.2%. That will save families thousands of dollars that they can put back into our economy, invest in their kids, invest in their home, or do whatever they like to enjoy the Colorado we love. I'm proud to turn it over to Commissioner Conway to further update you on the implementation of the reinsurance plan. Commissioner Conway.
Thank you, Governor, and thank you all for being here today. So I think it's important to note a few things about this reinsurance program. First and foremost, this is something that we've been fighting for over 3 years. It's been something that 3 years ago we started a study to see if it made sense for us to institute a reinsurance program in Colorado. At the Division of Insurance, we completed that study, and lo and behold, the recommendation was that we should stand up a reinsurance program. In 2018, we tried to pass that bill. We tried to get that legislation through, but we couldn't get it quite over the finish line. It wasn't until we had this team behind me that we were able to accomplish that. The governor touched on them, but the senators that were the sponsors of this bill and the representatives were the keys to making this thing happen. And they were the stalwart supporters to make sure that every time that we hit a roadblock that we had a new path forward and we were going to find a way to make this thing work. But probably the one that was the most important in the mix was the governor himself, and he doesn't take enough credit, but it was his unenduring optimism that kept us pushing forward, that kept us finding a way to get to these numbers right here. The numbers that you're seeing right here, the relief that we're going to be able to provide for the people of Colorado. So I think it's important to note that the numbers that the governor shared with you for Pueblo, for the eastern part of the state, for Grand Junction and the western slope, that's rural Colorado. That's rural Colorado, and that's where the pain has really been felt over the last 4 years of the increase in premiums in the state. And it was because the governor, it was because Senator Rankin and Representative McCluskey listened to that pain, listened to those concerns, and responded to them, that we were able to get this past the finish line. It was also because of the folks standing behind us on either side, the consumer advocates that are here, Healthier Colorado, CCHI, CCAT. There's a number of them that I'm probably forgetting, but it was all of these folks that came to the Capitol, sat through hearings, were here to help us support and push this through, that we were able to get this done. This is something that I was really proud of. It was the main reason that I didn't want the governor to fire me, because I wanted to try and get this bill through. So I was really excited when he didn't fire me, and then even more excited when we got this thing done. So what's the timeline? What's the timeline for our federal approval? And what, more importantly, are we hearing from the federal government? As the governor said, we've been in conversations with the federal government for years, really, but in particular on this plan for the better part about 8 months. We are hearing incredibly encouraging things from the federal government about our chances to get the waiver approved. They have told us that everything looks like it makes sense and that they believe that we should be hearing at some point in September on the approval process. So that's generally kind of the high level of what I wanted to go through with you folks, but I really can't emphasize enough how important I think it was to have the support and the amazing support of both Senator Rankin and Representative McCluskey, and then Senator Donovan and Representative Rich and the governor as well. We really wouldn't have gotten this thing through without this team that's up here today. So with that, I will turn it over to Tamara Dranksfeet to come and talk about what's going to happen up in Summit County.
Good morning, everyone. I'm Tamara Dranksfeet. I am the CEO of Peak Health Alliance, but I'm here today really as a resident of Summit County to express my deep gratitude on behalf of the residents of Summit County for the work that Governor Polis and Commissioner Conway and Senator Rankin and Representative McCluskey have done to pass reinsurance. For years, literally a decade, I have come down to Denver to talk about what high insurance premiums are doing in Summit County. I've talked about the mom who had to choose between her own breast cancer care and sending her daughter to college. I've talked about the parents that have to leave Summit County because they can't afford both health insurance and childcare. $9,000 is about what it costs to send a child to childcare in Summit County. And so in Summit County, what this means is that families will finally be able to access health insurance and access care for their children, not only ensuring that they as parents can work and do all the things that their kids need, but also ensuring that that child actually has a shot at a great life. All of these things are connected in Summit County's economy, and without the work of this administration, we would have continued to see the crippling double-digit premium increases that have meant that Summit County has both double the statewide average of uninsured and double the national average of rate of suicide, because when folks can't access health insurance, they also can't access mental health care. So truly today, on behalf of the residents of Summit County, we are so incredibly grateful for all of the work that has been done to get us here and the impact that this will have on our families, our children, and our community. Thank you.
And we'll be happy in a few moments to take questions on other topics, but let's first talk about healthcare reinsurance. Any questions on this? Yes.
Do you have an estimate on how many people you think you might bring into the market? Because you said 6 to 7% are uninsured.
6 to 7% are uninsured. I believe that there were assumptions in the modeling that Mike Conway done. What is it?
It's 3%.
3%. We obviously will see. It'll go down by 3%.
No, it'll be
3% more.
An increase of 3%.
Increase of 3%. Again, it's just simple market economics that when the price goes down, and people obviously want insurance, it's never a question of that, it's whether they can afford it. So it was a number that was used for modeling, but we will be happy in any decrease in the number of uninsured, and I'm confident that will occur. We will have that information by the end of the enrollment period shortly thereafter. We will be able to have the results of the impact on how many more people have insurance as a result of these savings. Joe? Not really taxpayer money per se. So original structures of this program looked at applying cost controls to those high cost cases. The two main funding sources for the model that you see before you today were some room that we had under the hospital provider fee, approximately $40 million if I'm not mistaken. And the other one involved reducing subsidies to large big box retailers like Walmart and others that effectively had been subsidized as a percentage of their sales tax. Some of that relief was given to Main Street businesses, also very important in our high country mountain towns in rural Colorado. Some of the proceeds are also being used for affordable housing and then finally for reinsurance. But those are the main sources for these savings. I can talk. We could get the information, but again, it was identified as particular sources, and I'll give you a couple reasons for those. The hospitals had agreed to, in their interests, come to the table around producing savings. We knew that they would have to take a haircut. They knew they'd have to take a haircut, but what's in it for them was shifting, of course, some patients, a significant number, from the uninsured category to the fully insured category. When you look at how hospitals and how their business model works, they have uninsured, they have Medicaid, Medicare, and fully insured. The fully insured patient is of greatest value with the highest reimbursement rates to any provider anywhere in the stream. So they were willing to have these tough discussions and come to the table around taking a haircut on the reimbursement rates, knowing that there would be more people with insurance at the end of the tunnel. Not every provider agreed with that, of course, but we worked with them in a responsible way to make sure that those savings were able to be reflected for actual savings for consumers in buying their health care.
Governor, is the 18.2% projection, is that entirely attributable to the reinsurance program, or are there other factors that are going into that projection?
That is the main driver. There's whatever noise there might be in a normal pricing year. I don't think there was much else, but that's the reason for the 18.2% reduction. Without that, it's hard to say. It might have been a few percent increase. 0.5% increase, but that wasn't where we were going, but something along those. But the reason for this savings of 18.2% and higher in many areas is the reinsurance program.
I'll go back to Joe's question. How
Yeah.
much is going to be in that fund?
Which fund?
Yeah, the reinsurance pool. How much is going to be in that?
Mike, do you want to address that? I mean, we have the reducing subsidies for big box retailers piece, the hospital provider fee piece, and I think those were the two main ones, right?
Correct. So the total amount for the state share, remember, there's the state share and then there's the amount of money that we get from the federal government. So the total amount in the state share is $90 million. The amount that we are going to get from the federal government to pass through to put into the program for next year is $170 million. And I think it's important, correct. So I think it's important to note, too, that our projection, the projection that we put in our waiver application was that we were going to see a 16% rate decrease. What we came out after the rate filings and saw is that it's going to be an 18.2% rate decrease. And that really speaks to some of the criticism that we heard during session and that these folks behind us had to deal with as they were pushing the bill through, that there was the argument that carriers were just going to pocket these savings. That's patently not true, right? And we see that here. They beat even what our independent actuaries thought they were going to be able to do, the insurance companies, that is. So it's an incredible win for the state of Colorado.
Like we talked about percentages, if we could put it, quantify an actual number. Some of the people we're talking about in the individual market, is it 100,000?
So it ranges about 225 to 250. So that 3% that I was talking about earlier, that 3% is going to be a 3% of that 225 to 250, that increase there.
So about 200,000 Coloradans, you think is
Correct.
Well, yes, and then with prices lower, more Coloradans will find the market attractive and move from the uninsured to the fully insured category. This is in many ways kind of, again, this is the the insurer of last resort in many ways. I mean, like if you're low income enough, you have Medicaid as an insurer of last resort. But if you don't get it through your job, or you're self-employed, or you have a small business without benefits, this is the place you buy insurance.
Before it was, before the final passage of reinsurance, the Hospital Association had concern and said to me that it could mean reduced access to services, maybe reduced staff, cost shifts elsewhere. If anyone were to lose their job in the Hospital Association or other areas start to cost more, is that on the hospitals doing that, or is that, does that mean this didn't succeed because it's being shifted somewhere else and other people are being impacted?
Well, hospitals have had record profits in our state, and to their credit, they were willing to come to the table around these savings, and through this mechanism, we ensured they actually reached actual consumers, actual families buying insurance, rather than getting intercepted by insurers along the way or by providers. The savings were directly passed along. Again, having more people that have insurance coverage will benefit hospitals, including rural hospitals that suffer from some of the highest rates of uninsured in areas that they serve, meaning that they have many patients who come in who either don't pay or pay whatever they can afford, or 20% of their bill because they can't afford more. They earn a little bit too much for Medicaid, but not enough to be able to afford insurance. Now many of them will be able to afford insurance.
Do we have any projections on the cost for most of us that get insurance through our employer? Have those numbers come out, or is that?
Well, that every employer is different. So I mean, there's no. I would add that some of our state policies will push that down over time. I mean, if we can get, for instance, the reimportation of prescription drugs, the hospital pricing transparency, out-of-network billing, expanding scope of care, but those are all separate negotiations that your employers have. So we hope, and even this will, because again, when more people have coverage, if we make a dent in the uninsured, that will also have savings for the employer-backed market. So all of this is tied together, but none of that was ever going to be for our legislators or for ourselves an excuse not to take fast action on the individual market, while we take our systemic approach to reducing costs for all the other forms of health care in our state. Yes, and then we'll go to other topics. Well, okay, yes, other topics. Well, I was very proud of CDOT for a day ahead of their own schedule getting 2 lanes open, eastbound and westbound, as the work begins to be undertaken for the repair from the landslide and the moisture that occurred with the deterioration of the clay level. So again, our men and women that work at CDOT really stepped up, put in a lot of extra hours, and were able to reduce the closures to the minimum amount necessary.
I know that saying all hands on deck, but there've got to be people that are looking at the contract with plenary, previous contract that did phase 1. What have you been told as to the responsibility of who's going to have to pay for it?
Certainly, we have indicated to CDOT, and it's certainly the Department of Transportation's approach, that they will do their best to hold parties accountable and to make sure that taxpayers are made whole to the extent possible and that people are accountable for their work.
There's been some, this is on the DLM moving to Grand Junction, there's been some concerns by congressional Democrats that the announcement by BLM and by the Trump administration is being done without the approval of Congress. Are you having discussions with our delegation about that?
I haven't heard from our delegation about that. In prior sessions of Congress, Ed Perlmutter and I both sponsored legislation to move the BLM to Grand Junction. While legislation might be necessary for the move of the thousands of employees and the headquarters, because an appropriation would likely to be attached to that, there's no strong argument that there would be legislation needed for moving 80 or 150 employees. That's absolutely within the administrative capacity of the Secretary, and I was thrilled that Secretary Bernhardt and the BLM will be bringing at least 80 jobs to Grand Junction, and we look forward to being a great place for people to work, closer to the lands they manage, and be able to help support our Western Colorado economy.
For the first time in nearly 100 years, voters could be voting to recall a law that you signed into law. We're talking about the National Popular Vote Compact. Any thoughts? Do you still stand by your decision to sign that into law?
Well, we have the safety clause, which is in some legislation, not in others. So people have the ability to petition. I think that's great, not just for repeal of laws that the legislature does, but they can, of course, petition for any law, any idea they have, and if they gather enough signatures, that'll be on the ballot. And, of course, many of the most important laws that this state has were passed not by the legislature, but by the people of Colorado. And so if they collect a number of signatures that's sufficient to get it on the ballot, the people of Colorado will have their say. Great. It's a categorical no, Marshall. Thank you. Thank you all for coming. Thank you guys so much. Thank you. Thank you, Julie.
Thank you.
Thank you.